Dear students, yesterday we had a class on embolism. So, what do you expect from this picture? Yes. So, this is a rose. Yes, correctly said. Some of you have said rose. What has happened to the rose? Is the color gone or is it still preserved? So, the rose is looking burnt out. Half part of it is dead. Okay. So, can you guess the topic of my class today? This is the last class for hemodynamics. This is infarction. Okay. Are you all with me? Yeah. So again and again, I'm telling you, the definitions are very, very important. Okay. They can be asked in the theory and also the practicals in the orals in the afternoon. So, what is an infarct? It is a localized, each word is important. Okay, when you're writing it, a localized area of ischemic necrosis. I think you know or what are all the different types of necrosis. This is caused by occlusion here, this word is important, of either the arterial supply or venous drainage in a particular tissue. I'm sure you can remember it's a localized area of ischemic necrosis caused by occlusion of either the arterial supply or venous drainage in a particular tissue. So just look at what is happening. This is the heart. Okay, the heart is still beating, whereas there is a dead heart muscle you're seeing here as a discolored patch. Okay, there is a infarction here and there was atherosclerosis. Can you identify this vessel? This is the coronary artery. So again, this is the part of the infarct area in the cardiac muscle. So, what are all the types of infarctions? So, we'll go into the myocardial infarction, cerebral infarction, pulmonary infarction, renal infarction, splenic infarction, bowel, and diabetic dry gangrene. I think you know by now general pathology is mostly over. So, gangrene is of two types, dry gangrene, wet gangrene, and gas gangrene. So, here we talk about diabetic dry gangrene. So, what are the causes of infarction? They can be intravascular, vascular, or extravascular. So, intravascular, vascular, extravascular. And arterial occlusion by thrombi or emboli, and there is local vasospasm, hemorrhage in the atheromatous plaque, extrinsic compression of the vessel by the tumor, twisting of the vessels, testicular torsion or bowel volvulus. Both these torsions are acute complications you may come across when you're doing your internship or post graduation. Edema inducing ischemia, hernial sac entrapment, and traumatic rupture of blood vessels. So, what are the types of infarcts? Infarcts, as I said, can be based on color or based on presence or absence of infection. We were talking about it in embolism also, if you remember. So, based on the color, red infarct, white infarct, based on this reflects amount of hemorrhage, based on the presence or absence of infection. Yes, you're right. It's septic or planned infarct. Okay. So, color and infection based on infection, absence of. Then factors influencing an infarct: nature of vascular supply, rate of development of occlusion, vulnerability of a given tissue to hypoxia. Not all tissues are equally vulnerable. Some of them are very resistant, or some of them are very vulnerable. Blood oxygen content and nature of vascular supply. Now, this question is often asked in the orals. So, which are all the organs which have double blood supply and which are the organs which have single blood supply? Okay, so these are with an alternative supply. See, if we are going in a road and there is a jam, suppose there is a side road, we just go bypass that main road and go to our destination. Similarly, organs with an alternative supply are insensitive to infections. Remember this: lungs, they have pulmonary bronchial circulation, liver has hepatic artery and portal vein, hand and forearm have radial and ulnar. So, lungs, liver, and hands, they have double blood supply. Organs with end arterial circulation, they are prone to infarction, like brain, the spleen, and the kidney. Because they have end arterial circulation, they're more prone to infarction. What is the rate of development of occlusion? Is occlusion sudden or gradual? How is it? So, slow occlusion, no infarct, because the organs have time to get ready for it. whereas it provides time for development of collateral circulation, sudden occlusion, infarction. So, what is the vulnerability of tissues to hypoxia? This again is important. It's a PG entrance bit. So, tissues which are highly vulnerable are neurons, 3 to 4 minutes. Just imagine 3 to 4 minutes if there is no circulation, the neurons die. Okay. And myocardium, 20 to 30 minutes. This is known as the golden hour. Tissue and this is the time if suppose somebody gets a myocardial infarction and a cardiac arrest, if you can rush that person to the hospital immediately within 20 to 30 minutes, most of the times the patient can be saved. Tissues which are less vulnerable are fibroblasts, which remain viable even after hours, and the other skeletal muscle. Usually, it is not very susceptible. Oxygen content of blood, does it matter? Yes. Congestive cardiac failure, compromised blood supply, anemia, and cyanosis. Normal oxygen content, there is no effect. When there is oxygen content is decreased in the blood, like in congestive cardiac failure, compromised blood supply, anemia, and cyanosis, then it goes into infarction. So, what are the features? Cross features in white infarct, red infarct. I was talking to you about the colors. So, white, red, in septic infarcts, microscopic features like coagulative necrosis, liquefactive necrosis, and abscess. Okay. So these are the white infarcts. Yes, you can look at the organs, and these are the red infarcts. So arterial insufficiency, not reperfused, single blood supply, end arteries. Here there is venous insufficiency or reperfusion or dual blood supply. Okay. So now let us look at the shape, color, margins, the consistency, and surface of infarcts. So morphology, what is this here? Why did I put this picture? Yes, I think you can identify. This is a wedge of a watermelon. Why am I talking about a wedge here? Okay, let's go into it. So wedge shaped with base at the periphery and apex towards the hilus shows blockage of the vessel. This is how it is. Base at the periphery and apex towards the hilus shows blockage of the vessel. This is a wedge shaped infarct. Okay, poorly defined, slightly hemorrhagic, healed stages, it shows scar tissue with depressed area on the surface. Okay, now when we take a bit of it and look under the microscope, it shows ischemic coagulative necrosis. Yes, can you see? This is all the impacted area. Necrotic area is replaced by fibrous tissue, which is a scar. So I told you two organs that they should not get a scar. One is heart and the other is the brain. Yes, good. So now looking at the types of infarcts, red infarcts and white infarcts, hemorrhagic, non-hemorrhagic, venous occlusion, because in arterial occlusion, area of infarct usually double blood supply, single blood supply, brain, gut and liver, the seen in kidney, myocardium and spleen. So, white or anemic infarcts occur in arterial occlusions, in solid organs with end arterial circulation, heart, spleen, and kidney. Again and again, I'm repeating this because it's an important point. Okay. Then, this is a splenic infarct on gross and splenic infarct on microscopy. You can see that there's area of infarct. You can see that there is viable splenic tissue here. Now let us go and see how a renal infarct looks like. Okay. So this is again infarct. I've shown you what is the shape of this. It's a wedge-shaped infarct, and this is a wedge-shaped, and it is white or pale infarct. So this is the kidney. Can you see? This is infarct, and this is the pale. It's not red. So on microscopy, can you identify this tissue? Yes, this is the glomerulus, these are the tubules, and this is the stroma. So what has happened to the tissue here? The renal tissue has all dissolved, sort of disorganized. So it is undergoing infarction. So this is the brain. So there is cerebral infarction with liquefactive necrosis. Can you imagine the state of mind of the concerned patient? Of course, this is a postmortem specimen with the brain which has been taken up after autopsy. Okay. So, red or hemorrhagic infarct occurs in venous occlusion. Okay. Can you see? This is the infarct. red. Okay. There is discoloration, whereas the previous impacts were all pale. Loose tissues like in lung, tissues with dual circulation like in lung and small intestine, and previously congested tissue. This point we have to remember. Previously congested tissue, if it undergoes infarct, naturally it is going to be red. So, can you make out? This is the infarct. The whole thing is an infarct. Following fragmentation of an occlusal embolus, yes, cerebral infarction, microscopy. There is cerebral infarction. Yes, yeah, here. Now, well, let us have a look at the infarct of the lung. So, yes, I think by now you're all used to infarcts. Here there is one, discolored. Previous white infarcts were white, pale. These are red infarcts. So, again, this is a lung tissue. Yes, alveolus. And there is here, the entire thing is undergone infarction. There is inflammation here. You can see the neutrophils. Now, it is looking very dangerous. Yes, this is a gangrenous necrosis. The entire bowels have undergone necrosis. Luckily, the gut, the bowels are of long, the segments are very long. So the surgeon can most probably remove part of it which has gone undergone necrosis and still do end-to-end anastomosis and save the patient. So, can you see? These are all the glands, mucosa, submucosa, muscularis, and serosa. So, there is infarction in the intestines. So, discipline is doing what needs to be done, even if you don't want to. Sometimes, uh, before I finish my chapter in hemodynamics, I would like to tell you pick up whichever book you want to, okay? Whether it is Robbins or Harsh Mohan, pick it up and follow it up. Don't start reading with Robbins first and then suddenly after 2, 3 months you get tensed up when after you have the first internal and shift to some other book. So just stick on to any book because we don't advertise for any books, we don't recommend. So it is for you to read. We are here doing the facilitation or guiding or mentoring for you to read. Okay, so you read it once thoroughly, and then what you do is you pick up the question papers, the old question papers, which will be there in the library. So, or you can form a group, and each system you can allot to one group and prepare the questions. So, while you're reading the questions from the textbook, mark them like what is the problem based question or essay question. So, you read for it and what are the big questions, short questions, and very short questions. So when you're reading it, your mind has to be tuned. So this may come as an essay question with a problem based question. So you have to be prepared for it. And now the NMC has introduced multiple choice questions also. So whichever question, essay or shorts or very shorts or multiple choice, it doesn't matter if you have read the subject thoroughly. Okay, once you read the subject thoroughly, it is easy for you to answer any part of it. Previous batches, if you remember, if you have gone through the question papers, the students have got bone tumors. So the students came after the exam running to us saying that we didn't expect bone tumors to be given as an essay question. Why not? Why not? Because once you pass pathology, you're supposed to know everything. It's not like you have a choice. So, medical students don't have choices. You are supposed to read everything and you try to blend and try to answer all the questions, whichever is given. And one more point, what I wanted to emphasize is try to give importance to the marks. Suppose the question is for 15 marks. Okay. So, you will be timing out. Suppose there are 180 minutes, you will time it in such a way that the 15 marks question gets what you write, what it needs to be for you to get 15 marks. Otherwise, if it is a very short question, you know it very well and you expected it to come as an essay, you're not supposed to write pages and pages because you will be getting only 3 marks out of it. Okay. So the current is gone. Yeah, it's come back. So take time to see and allot your time wisely. And one more point is draw pictures. If pictures are not there, nobody is going to give you marks. And And unless you there are flow charts drawn, you can't get marks. Okay. I hope you will read this chapter as soon as you go home, or as again and again I say, once you read after the class is over, it is very easy for you to remember what we tell in the classes. Okay. So, yeah, let us meet. I'll be taking a CVS for you. Let us meet then. Till then, keep reading. Okay.